So our last video where we reacted to Stephanie's video on Kendall Jenner did well, so we decided to do another one. This one's about Kim Kardashian. Let's go.
Kim Kardashian's crazy transformation. She is generally regarded as one of the world's most beautiful women, and let's be real, she is. She has always been stunning. However, despite that, she has also had a very dramatic yet subtle transformation over the years. And it's basically been swept under the carpet, and no one, including Kim herself, really seems to acknowledge it. Now, Kim's influence can't always be said to be positive, and that's okay. I feel like this is where we go wrong when we put other human beings on pedestals as being so much more important and beautiful and influential than anybody else, and we expect them to be perfect, and then when they're not perfect and they inevitably fuck up, everyone is shocked by it. In saying that, it is important to acknowledge the effect that Kim has had on humankind everywhere since she burst onto the scene back in 2007. There are women who literally spend their entire life savings to look like Kim Kardashian.
Yeah, I heard there was one person who spent like $500,000 and then another $150,000 to detransition is the terminology that was used, which I don't know, that's really out there. But yeah, people are spending money to look specifically like Kim. So my message to people in general who are interested in plastic surgery to improve certain features about themselves is always just become potentially an optimized version of yourself. Don't try to be somebody else. That never works out.
Truly believe that she is perfection personified. Like, look at the case of Sherry Lee, who has spent over $60,000 to change her naturally gorgeous self to look more like Kim. Sherry herself says, "Kim has always been an inspiration to me, and she is the most beautiful woman in the world in my eyes." Sherry has since gone on to have 3 BBLs, 2 boob jobs, and several facial reconstruction surgeries, all to look more like Kim Kardashian.
Yeah, that's kind of sad. And, I always ask my patients like what their goals are and why they're looking to get a certain procedure done. I think it's important for surgeons to inquire about that because obviously mental health and plastic surgery are intertwined in many ways. Most patients who get plastic surgery, at least who come to my practice, are very stable mentally. They're very normal people who just want something enhanced. They want a slightly better version of themselves, or they want to look like they used to look 5-10 years ago. But for the folks who are looking for a complete transformation into someone who doesn't even nearly resemble what they looked like originally is not healthy, and that ought to be stopped at the level of the surgeon, who plans on doing the procedure. So it's okay for a person or patient to have thoughts like this, but I think it's up to the medical and surgical community to put a stop on that type of behavior and say, we're not going to condone that. We won't operate, if your goal is to look like someone who's completely different looking than yourself, because the intensity of the surgeries that it takes to get someone there is immense, and it can't be easily undone. Most of it can't be undone at all. So it's something important to keep in mind as a society, I think.
Even argue that the effect that Kim has had on her own younger sisters has been somewhat detrimental. When you look at the very dramatic physical transformations that they have had at such young ages, and in a strange way, it's almost as though Kendall and Kylie in particular are trying to alter their looks to look more like Kim. Could it simply be sisterly love? Or have Kim's little sisters felt the pressure of being in such an aesthetically obsessed family?
Yeah, I don't think it's sisterly love in this case. I think it's the latter. Yeah, I mean, it's this whole desire to look like somebody else and to do surgeries at a much younger age than what we used to see before the Kardashians came onto the scene. It is a bit alarming, I think. And it's the trend that will, unfortunately, I think, continue. At some point, it's just not wise to start too early.
And as such, felt the need to change their looks to better resemble their beautiful and successful older sister, without whom themselves would likely never have even achieved fame and fortune to begin with. So Kimberly Noel Kardashian was born in 1980, making her 42 years of age now. On the surface, looking at Kim, it wouldn't appear as though she's had much done in the way of surgery or tweakments. She doesn't necessarily look overdone or overfilled or botched, but as you guys can see at a quick glance, she absolutely has changed a lot since she became famous.
We have a video on Kim Kardashian's facial transformations. Make sure to check that out, as well as a recent video on Kim Kardashian's hair procedures. So make sure to watch that video as well.
And yes, a lot of that would have to do with aging. I mean, she was 27 when she became famous, and now she's 42. So that is a long time, and your face is inevitably going to change a lot in those years. But is your nose going to shrink? Are your lips going to get bigger? Are your cheeks going to get fuller? No, actually, In fact, quite the opposite usually happens. Fun fact, your nose and ears actually never stop growing your whole life. So what has Kim done to, number one, halt the aging process, and number two, stealthily alter her appearance in such a way that she is now generally regarded as like the epitome of the beauty standard, and no one really noticed? I personally think that Kim has changed just about every aspect of her appearance. But we'll start with her nose. I do think that Kim's nose has been tweaked in a very dramatic but sneaky way, so that on the surface it looks like she hasn't touched it. That is just the nose she was born with. But when you look into it deeper and you compare...
Well, keep in mind that good plastic surgery should whisper, it shouldn't scream. So it's very normal to have plastic surgery that's done well for it to then not be noticed by most people. If the surgery is very much obvious and everyone can pinpoint exactly what changed, then it probably wasn't the best quality surgery in the first place.
Original Kim to current Kim, you'll see that her nose is actually very different. If you look at these pictures of original Kim before she achieved worldwide fame, you'll see that her nose was quite a distinctive shape. From side on, you can see that her nose sloped out and downwards, which is what mine does too, with a distinguishing hump on the bridge. According to an article I found, these beautiful people are Kim Kardashian's Armenian ancestors. And I quite believe it. The family resemblance is really strong, and I think it's such a sacred and magical thing to have such a strong physical tie with your ancestors. As you guys can see, the resemblance between Kim's ancestors and her dad Robert Kardashian is super, super strong. And that absolutely has filtered down to Kim, as she in turn very much resembles her father. It's not shocking, it's kind of how genetics work, but I personally love it and I find it so interesting. It makes it a lot easier to block out the unrealistic beauty standards and appreciate your own unique characteristics when you can actually see why you have them and where they came from. Like, look at the crazy resemblance between this ancestor and Courtney, for example, and this young man and young Kim. I love this stuff. Kim's original nose was very similar to the nose of her Armenian ancestors, but her current nose, not so much. So what happened? Well, Kim's genetics haven't changed, so my guess would be that she underwent a surgical nose job to change the slope of her nose, refine her nostrils, and give her nose a more upturned tip. However, an interesting thing to note is that to an extent, she chose to keep the hump on the bridge of her nose. Why would she do this? Why bother going to the pain, effort, and expense of a nose job if you're going to leave the hump on the bridge of your nose anyway? Well, it's actually quite common in Hollywood for famous celebrities to refine their noses, but leave a small imperfection to make it seem as though they are au naturel.
Yeah, we saw this with Hailey Bieber, and we also saw this more recently with Gwen Stefani in doing a reaction to her facial transformations.
Hailey Bieber is rumored to have done this, as her nose does appear to have been refined, and yet it still tilts to the right. Blake Lively slimmed down her nose and yet kept the original shape, just made it smaller.
Also, something to keep in mind is that it's very difficult to completely alter someone's nose into someone, like to make it look like someone else's nose. I mean, you'll still have some of that core structure. You can just kind of modify it to a degree, but you can't really convert it into a totally different nose unless you take away so much tissue and cartilage that you actually collapse the nose. And we've seen that, of course, with Michael Jackson and other celebrities too, and other people. So you don't want to completely alter the nose, too much. But of course, when it comes to the hump, that's a very personal decision whether or not to take that down or leave it where it is. But these types of smaller tweaks to the nose is actually very normal. And some patients who come to me asking for more radical changes to their nose, I explain to them that given the thickness of their skin and the overall appearance of their nose relative to the rest of their face, it wouldn't make sense to do anything too major as far as modifications go.
Kim's own sister, Kendall Jenner, who also seems to have had her nose refined, but still kept the original slope to her nose so as not to make it look obvious, like her sister Khloe, for example, who has had a nose job and totally went to town. Or Bella Hadid, who changed her entire appearance when she changed her nose. Kim has kept her alleged nose job subtle in comparison, and it's worked, as most people still don't think that she's had one. But I personally think when you compare pictures like this of...
You can also see in the size of the nostrils and the nostril opening how it's been changed with the modifications, with this like deep projection of the nose and this increased rotation of the nose. The opening just looks different, and that's not something that just happens on its own.
Original Kim and this of current Kim, it's pretty darn obvious. Of course, Kim denies having had a nose job. Then there is Kim's changing lip shape. Now let's be clear, Kim has always had full lips. And full lips are the current Western beauty standard, so that works well in Kim's favor. You would think then that there would be no need for Kim to change her lips, right? Wrong. As you can see in these older pictures compared to
Wrong.
these pictures, it appears that Kim absolutely has changed her lips, but again, in a very subtle way. But it hasn't always been subtle. Just like with most others who get lip filler, sometimes it's easy to get a little bit over-enthusiastic and get just a little bit too much put in, and bam, you have the dreaded duck pout. As you guys can see from the side, Kim has at times been a duck too. And Kylie. It happens. It's not permanent. It's not the end of the world.
And we talked about with Kim in the past how it was likely the result of a lip lift that allowed her to remove that ducky appearance of filler that was making her lips more protruded and reestablish the kind of flatter to the face type of form to the lips and to reduce that filtral distance, especially because of the rhinoplasty. Anytime someone gets a rhinoplasty, they're at a pretty high risk of having a longer philtrum because of the fact that they had the rhinoplasty. So then to counteract that, it seems like Kim went the lip lift route, shortened this distance, the lip flipped out, this distance shortened, it was still flatter to her face, and the lips also look fuller because of that. And what I talk about in some of my lip lift videos, which is I think an interesting phenomenon, is as the upper lip gets larger and it gets closer to your nose, the bottom lip usually tends to increase in size as well to help it meet that upper lip. So it tends to give the impression of a larger lower lip as well.
It does go down, it's okay, but it's annoying. And it makes it very, very obvious that you've had lip filler. And if you, like him, are trying to make out like you've never had filler or never had any tweakments, it can be really annoying because it makes it really obvious that you have. Another aspect of Kim's facial appearance that I think has made a huge difference to the way that she looked before versus how she looks now is that she has changed her smile. What a random thing to do considering her natural smile was so bloody beautiful. And now her smile is just very generic Hollywood. It's like she slowly over the years began erasing her individuality and quirks. In her older pictures, her smile was very similar to that of her sister Courtney and her dad Robert, but now, I mean, it's still beautiful, let's be honest, but it's just different. She may have changed her smile by getting lip filler, but I think it's more likely that she's underwent a lip lift and Botox in her philtrum to drop her top lip. Now, what the f does that actually mean? Well, a lip lift is when a surgeon...
Oh, she's going into lip lift discussions. Great. Let's see if she's used our video like she did last time in that other video.
will go in and cut a portion of the skin between your lip and your nose, pull your top lip up, and then sew you back together. It means that your top lip will look fuller and poutier.
I don't think those are my before and afters.
Naturally, without the telltale lip filler look. Now, Botox in the philtrum is actually a...
Also, just keep in mind here, in this image that I'm looking at here at 731, yes, I agree with what Stephanie's saying so far, but with the arrow pointing to the lateral aspect of the upper lip, it's important to mention here that with a lip lift, it's usually the central 2/3 that are being lifted. The lateral elements usually stay in and inverted if that's the way that they start. It's just that there's not that much impact on the lateral lip when it comes to a lip lift. So in order to address the lateral elements, you would need a corner lip lift, and that is something that can be done at the same time as the regular bullhorn style lip lift, or can be done in a more delayed fashion. I personally like to do it in a more staggered way, to do the lip lift first and then see if the person still could benefit from a corner lip lift, and also because that gives me the opportunity to monitor how they heal. If the healing isn't optimal, then I wouldn't want to give them a scar right at the vermilion border for a corner lip lift.
Naturally, without the telltale lip filler look. Now, Botox in the philtrum is actually a super common procedure. It takes like 2 minutes to do. It's not difficult. And that's where an injector will put a bit of Botox between your top lip and your nose, which will relax the muscle there. And as such, when you smile, your top lip won't be pulled up so high. Like for example, Kim's old smile, where you could see her whole row of top teeth. Now when she smiles, her top lip sits lower and covers the top of her teeth.
Keep in mind also, it may have been from the rhinoplasty. As I mentioned earlier, when you do a rhinoplasty, you're disrupting some of the orbicularis muscle as you manipulate the tip of the nose, and that could also drop the philtrum and make it so that you're not smiling as fully as you used to before. So maybe it's the Botox, but my guess is there's no reason for why Kim would have gotten Botox of the type that Stephanie's describing. Maybe she had some Botox right at the vermilion border to give her a little bit more of a flip out of her lip, but getting Botox into the depressor septi muscle or along the base of the nose in the upper philtrum to drop the upper lip, I'm not sure what the purpose of that would have been for her. I think that would have been disadvantageous, and the whole purpose of getting the lip lift for Kim was to reduce that distance, so she would be countering that with the Botox injection. So I don't think she was getting that.
A lot of people do this procedure if they feel like their smile is too gummy, so perhaps Kim felt the same. I do think that for a while she went too far with the Botox and the relaxing of the top lip, because the gap between her nose and top lip just kept getting bigger and bigger, and she honestly stopped looking like herself for a while. Kim's smile.
Also, I should mention here that the philtrum lengthens with time. So Kim is not, 20 years old anymore. So that distance would have been increasing with age anyway. So those, I think, are the more common reasons and also the most likely reasons for why Kim's philtrum got longer. Both aging process and the fact that she had a rhinoplasty, as opposed to these Botox injections of the type that Stephanie's describing.
Also used to pull down at the corners of her mouth, the same as her sister Courtney and her dad and her granddad, and it was...
Because look, even at this picture of her at age 11, she's still not showing gum at her full smile. So it's not like she overly had like too much gum show with smiling. So again, another reason why I just don't think that she had those types of Botox injections.
Lovely. Now it doesn't. I'm not entirely sure how this change occurred, but I would suspect potentially Botox in the corners of her mouth to stop the muscles pulling down when she smiles. I don't know if any of you guys have any theories as to how one achieves this. I am intrigued. Let me know in the comments.
So what I'll say here is that to me, when Kim was younger, it doesn't seem like she had that sort of pull down of her smile that Stephanie's describing. We'll flash some other images of patients who do have that type of phenomenon that can occur. For those types of patients, injections of Botox into the DAO muscles, the depressor anguli oris, those are the types of injections that can relax the muscle that pulls down the corner of the lip and allow it to be in a flatter, sort of more stabilized position higher up. Now, that is the type of injection that's done when you really have that kind of downward pull, but I don't see that in Kim's appearance when she was younger and smiling.
Then we have Kim's cheeks. Not her butt cheeks, but these things. Kim, the cheeky sod, even goes as far as to deny having filler. Excuse me, what do you take us for? It's quite clear to me that she has totally dabbled with her fair share of filler, and that's okay. Getting tweaked.
And we talk about cheek implants for Kim in our video, but also most likely she at least dabbled in filler as well. I do agree with Stephanie on that.
Getting filler, heck, getting cosmetic surgery, it's not a crime. We are all free to do whatever the heck we want with our faces, and it's not something to be embarrassed about or ashamed of. To me anyway, it seems that Kim has definitely had her cheeks filled. Whether it be with filler or implants, which in fact would mean that technically she's telling the truth when she denies cheek filler, her cheeks have definitely been plumped. Looking at pictures of original Kim to current Kim, her cheeks were always lovely and full, but now they have that telltale high, stretched, full look. Then there is Botox. Now Kim claims that she is in fact allergic to Botox, and that whilst she has dabbled with Botox in the past, she now has chilled on it. I call bullshit. You can literally see the telltale signs of someone who has utilized the muscle relaxing and tightening.
Now, some people over time become more tolerant of Botox in particular, so they might need to switch to a different neurotoxin so that, they can get the same effect they used to get with Botox. So that's possible. Something like Dysport is maybe what she's using now, but regardless, she's most likely using some form of neurotoxin to give her that smoother appearance, especially to her forehead, glabella, crow's feet area.
Effect of a lot of Botox. When Kim tries to cry, she literally struggles to frown and scrunch up her eyes, as her muscles have been paralyzed and she can't do it. Sometimes she'll have one eye squinting.
Many actors have moved away from using neurotoxin because they can't deliver those facial expressions that we expect of them when they're acting.
And the other not, which can happen from Botox too. But sometimes one brow appears a little bit higher than the other, and it's as though she can't level them, which happens to be another side effect of Botox. Her mum Chris often has the same side effects, which is normal, to be honest. Botox is great, it's effective, and it's minimally invasive, but it isn't without side effects.
And now there are different types of neurotoxins that are purported to be lasting much longer, like closer to 6 months. But imagine if you cause a lot of asymmetry with the brows, now the person has to wait 6 months before that will self-correct, as opposed to the 3 months that Botox usually lasts. So that's one of the disadvantages to these neuromodulators that are lasting much longer.
There's also rumors that Kim has undergone a facelift, which
Yes.
I don't know if I agree with. I think it's highly possible, knowing how obsessed Kim is with her looks and keeping
Yes, it looks like it's more than highly possible. And again, we discussed that in our video.
a youthful appearance. And there are accounts online who are adamant that you can see telltale scars that prove she's had a facelift. But I mean, 42 is not old. It's not surprising to me that Kim looks young, because in the grand scheme of things, she is. This is not a woman in her 80s that we're talking about. So I don't know about that one. I think it's highly possible and probably quite likely, but I'll reserve judgment on it because I don't think it's quite as obvious as her other tweakments and surgeries. Now you have to ask yourself, why would someone who was as naturally gorgeous, like naturally stunning as Kim Kardashian, go to such efforts and expense and pain to alter her looks to this extent? Was she, like Bella Hadid, subconsciously trying to erase her ethnicity? I think that she probably thinks that her worth is based on her looks, and that if she were to begin to show the signs of aging or to lose her good looks in any way, that she would no longer be considered successful or beautiful, and she just frankly wouldn't be able to handle that, because being beautiful and
I think Kim recently said that she would just do anything that needed to be done to look more youthful. And so that, yeah, I think what Stephanie is saying here makes sense.
being successful is basically all she's ever known. And if she thinks that her worth as a person is based on her looks, then aging or gaining weight or not fitting the current beauty standard would simply be unacceptable to her. But the thing is, Kim is so much more than her looks. Like, she is a successful businesswoman. She is a mother.
But we do have studies out of Hopkins for facelift results, rhinoplasty, and hair transplant that all show that there is an impact on success for people who get these procedures done. And so it's not just how you feel internally. It's not just this perception that maybe people will think of you as, more successful or less successful if you do or do not get plastic surgery. There really is a direct correlation between people who get these procedures that are, of course, done well and the way other people perceive them. And that's been documented in the studies out of Hopkins. So yeah, I mean, there's a lot that's involved with plastic surgery, especially changing one's face and one's identity. And I think it's a complicated matter, and maybe Kim has reasons beyond what Stephanie has brought up for having these alterations done to her face and to her body, of course, as well.
She is a mother. She is someone's daughter. She is a sister. Her looks aren't her. They are surface level. And I just hope that she knows. And I hope that she knows that she is so much more than her looks, because that would be such a superficial, downright depressing way to live.
Yeah, I mean, Kim seems like a really intelligent woman, and I'm sure she knows all that as well. But, to maintain that top standing that she has in society, I think she probably feels the pressures to do these different procedures to stay looking the best that she can possibly look, and setting the standards for many other people. Hopefully you enjoyed this video, and make sure to check out our other reaction video to Stephanie's take on Kendall Jenner.